If you clicked on this video, you're probably applying for physical medicine rehabilitation, or at least pm&R curious. If so, then this is the video for you. I'm Dr. Sharma. I'm a sports and spine physician, recent physical medicine rehabilitation graduate, and in this video, I'm going to be talking about how you can be successful applying for pm&R. This video is a little different than what's been on my channel recently, and that's because most of my pm&R focused content or sports and spine type content is over on Instagram, so go check me out there if you have not already followed me there. That's at the MSK Doc. Most of what I've done on this YouTube channel is kind of vlogs, but I've had some mentees recently who I just started kind of chatting with, and a lot of their questions are obviously based on, hey, how do I apply and how do I be competitive for pm&R? So I'd figured now was the time to kind of make a video as the rising fourth years are there, but this video is honestly for anyone. If you're interested in pm&R, then this is how you can kind of maximize your application to hopefully become a more competitive pm&R applicant. If you're at that stage where you're pm&R curious but not necessarily committed to it yet, and you kind of just still want to learn about this field and specialty, then go check out one of these previous videos. I don't know which corner it'll be on, but it'll be there. It kind of goes over all of what pm&R is. If you want to learn more about my pathway, then I also have a video on my fellowship that'll also be there somewhere, so go do that. Before we get any further into the video, also remember, always take everything I say with a grain of salt. I applied over 5 years ago now, so things may have changed. So these are just more or less general tips, not the nitty-gritty of what I think can make you a competitive applicant for physical medicine rehab. All right, number one, and this isn't really necessarily a tip even first off, it's just know what you're getting into, know what the field really is. I've seen and heard of a lot of people that kind of go into the field thinking, oh, it's just orthopedics just without the surgery. That is not it. There's also a lot of people who think they want to do like pain medicine and they kind of go gung-ho on pm&R for that, and that's all they really want. This is not the field for you if that's the case, and if you're applying to pm&R and that's kind of the notion that a lot of these program directors or whatnot pick up, then they're less likely to kind of say, hey, this will be a well-rounded applicant. He might not work as hard in some of our rotations, so less likely you might be a little bit less competitive. So if you're already applying, it might be a little bit too late, but if you're not already applying and you're not 100% sure about it, and you don't know all the aspects of pm&R, then my 100% number one recommendation is to go shadow. And not just the part of pm&R that you think you like, but all of it. So go shadow on inpatient if you can, go shadow on outpatient if you can, go shadow like TBI patients, spinal cord injury patients, and also the pain, MSK, all of that aspect. Know what the field actually entails before you dive into it. All right, for the rest of this video, I'm gonna break it up into 5 different parts. Number 1 is boards. Number 2 is your letters of recommendation. There's research, networking, and extracurricular activities. All right, number 1 is boards. And when I was applying, everything had scores. So step 1, COMLEX 1, step 2, COMLEX 2, all those different kinds of things. So it's a little bit different now. Number 1, make sure you're passing your boards for your step 1 or your COMLEX level 1. I'm a DO, so I did take COMLEX as well as step. My recommendation is probably still to take both of those exams just so that you have a little bit more of an apples to apples comparison. I've seen sometimes when you have people looking at scores that they don't exactly know what a COMLEX score means, and there's like equivalency calculators and percentages and all those kinds of things online, but if you can see a number score in step 2 versus step 2, it's obviously going to be a little bit easier to compare all students across the country. It's definitely a little bit more of a hassle for us DOs out there. However, I still would probably recommend it, and I took both for both exams. So you've already studied for step 2, you might as well do a little bit extra OMM on top of that and take COMLEX 2 right after that. So that would be my recommendation for boards. But historically, pm&R wasn't super competitive in the past. That's definitely changed now where it's more and more competitive. So the better you can do on boards, the better. Number 2 is letters of recommendation. And the reason this is number 2 is because letters in pm&R go a really long way. Despite it blowing up now and becoming way more popular, physical medicine rehab is still a pretty small field, and a lot of those names that are kind of been around for a long time are really well known across the country. pm&R is still a really small field, and you recognize names kind of throughout the field. So if you can get letters from someone that's in pm&R, then that'll be fantastic and it'll go a long way. Now, I'm not saying you necessarily need a letter from someone in pm&R. Obviously, it's fantastic if you can get someone. But the important part with letters is really to make sure that you get someone that can write you a good, thoughtful letter and someone that knows you well. A good, thoughtful, detailed letter from someone who's in internal medicine versus a generic, bland letter from someone who's in pm&R is definitely going to lean towards a person in internal medicine because they know you well, they can describe your character, they can describe you as a learner. And a lot of students out there might not have access to pm&R, unfortunately. You're a strong kind of pm&R rotation where they can get that good letter. So really, the important part is having a letter from someone who knows you well and who can describe your character, your qualities as a medical professional, all those different kinds of things, because that is what we look at, that's what we read, and that's what we say, hey, this person could be a fantastic resident. As some rising PGY4s out there are setting up their audition or their sub-I rotations for PMR, my recommendation for letters of recommendation would be to, let's say you are doing a rotation at a place with a PMR physician. If you would identify this is a person that probably want to get a letter from, then tell them at the beginning of the rotation, just be like, hey, I'm applying for a PMR at this year, and I would greatly appreciate a letter of recommendation. If there's anything that I can do to make sure that I get a strong letter of recommendation, then please let me know. And then do that, and then if you can, exceed those expectations. That way, when the time comes at the end of the rotation for feedback and all these different kinds of things, it's not like a random, oh, by the way, can you write me a letter? They've got to know you, they've got to see how you progress, they've got to actually evaluate you while actually thinking of, hey, I have to write this person a letter of recommendation. And then if you go above and beyond what they kind of set as their expectations, then wow, even better, they can probably write you a great letter. All right, number 3 is research. Research is somewhat important in PMR. It's not like some of those surgical fields out there which are super like into that kind of stuff. You don't necessarily need a ton of research, but it's nice to definitely have some. If you can show some sort of scholarly activity that you're doing, it doesn't necessarily need to be a full-on publication of a systematic review or something like that, but just get something out there in literature, whether it's a couple of posters, whether it's a couple of case presentations, whatever it may be, just try to get something done as far as scholarly activity goes. If it is within the field of PMR, then that's even better. Doesn't necessarily have to be all the time, but it's definitely going to be a plus if it's related to PMR. My biggest tip for research is to genuinely find something you are interested in, because the last thing that you want to do is find something that you're not interested in, not do a great job, and then all of a sudden this person's like, hey, this person didn't really do a good job, and if you end up somehow asking them for a letter, then they might not be able to write you a really strong one. So if you are going to do research, or if you're going to get involved in something, make sure it's something you're genuinely passionate about, because then there's also a plus side. Let's say that this is a person that's a physiatrist who you're asking to try to do some research with. You go above and beyond, you do a great job because you're really interested in it. You can ask them for a letter of recommendation. Now, whoever this person is can write you a fantastic letter and also potentially help you network and reach out to people and all those different kinds of things. So if you're going to do research, make sure it's something that you're interested in. And number 2, it can be used as a networking tool, because if you do a great job, then that travels at times. You can ask your whoever it is, your PI or whatever, if they would mind making introductions, all those kinds of things. But it can also get you in the room for different things. So overall, research is important to have something. Don't need to have a lot. Try to be enthusiastic and really interested in what you're doing, and it's also more of a networking tool sometimes than actually truly just for the scientific portion of it. Number 4 is extracurriculars, and it's number 4, but it actually might be one of the more important ones to actually make sure that you're emphasizing your applications, because one of the key components of PMR is making sure that you're interested in PMR and that you really know it and that you embody kind of the characteristics and qualities of a physiatrist. If you went and watched that video about kind of what is PMR, you'll know that our mindset is different than a lot of other kind of specialties in medicine, whereas our mindset is more so, what is this patient's kind of function and how do we maximize it? How do we get them back to doing what they want to be doing, or at least to integrate maximally in society? And finding different extracurriculars to integrate yourself into that is very important when it comes to PMR. So there's a bunch of different ways to do that. I'm going to break that down further into things as national organizations, local groups, and then in kind of activities or volunteering. On the national level, obviously this is harder. Not everyone can do this, but there's a lot of organizations out there related to PMR where students can get involved. So that's things like AAPMR, there's the AAP for DOs out there, there's the AOC PMR, and there's a whole bunch of other kind of different things out there, representation and rehab, and all these organizations that operate more so on a national level, that if you can get involved in those, not only is it networking, but number 2, it shows leadership, it shows that you're really involved in the field, it shows that you want to be a leader in the field, all those different kinds of things, and also it helps you understand a little bit more about what the field really is as a student. So 100%, if you can, would try to recommend getting involved in a national organization at some kind of level, whatever you can do. Next up is your local groups. So there's a ton of local groups related to PMR interest type things. So I'm from Chicagoland, so there's a big PMR kind of fellowship there that's run by one of the attendings at one of the large academic institutions. So I was involved in that through an M1 because I was interested pretty early on. So getting involved in those local groups really helps you get the plug and understanding more about what the local community is like PMR based. It helps you get plugged in and integrated into local opportunities such as research type things. whether it's actual publications, case reports, and whatnot. It can also help you get plugged into different extracurricular activities out there that are going on. So things like volunteering, which we'll talk about in just a second, adaptive sports, and also it can help introduce you to a lot of the attendings in the area. So if you do have a geographic preference and all those kinds of things, you can potentially get involved early, stay involved, and then you start developing somewhat of a reputation, becoming a known quantity in your region versus just randomly being like, hey, I want to apply PMR. And then let's say you are in Chicago, you're a fourth year med student applying, you apply to a university and it's like, hey, how come I didn't know about this person for the last couple of years, even though they're interested in PMR? So get involved in your local organizations if they're there. This either is like the fellowships, there's often interest groups at your school as well, which count as local groups. There's journal clubs at local kind of PMR practices. So for example, my practice right now has a journal club that students have asked to get into and all those different kinds of things. So show your interest, get involved in those things. And the last thing is volunteering, or essentially finding ways to show that you are truly involved and interested in physiatry. So the classic one for volunteering, which really shows it's pretty niche for PMR, is adaptive sports. So adaptive sports is essentially patients who have somewhat of an impairment still being able to participate in what they want to do. So whether that's adaptive rock climbing, adaptive hockey, whatever it may be, there's a whole bunch of different activities out there. You can go and volunteer for those, understand what those patients' needs are, all those different kinds of things, and help get integrated into that. And that definitely helps as far as applications go. Volunteerism-wise, there's a whole bunch of different things, but essentially the idea is think like a physiatrist. If this is an activity that a physiatrist would be involved in, potentially think about, then go ahead and do it. It doesn't necessarily have to be adaptive sports, but it can be things that are helping people stay active, stay moving, all those different kinds of things that are helping maximize function and helping people enjoy their lives more fully. And last but not least is networking. And I know I've mentioned this a couple times already, but I want to mention this again because once again, PMR is a small field. Name recognition does go somewhat of a ways. So I'm not saying you have to cold email every single person that you really want to get to know, but if there's opportunities to go network, go introduce yourself, say hi, it does make a difference. So if you are going to a national meeting like an AAP or AAPMR, go around, talk to people, find genuine things that you can talk about versus just being like, hey, I'm a med student over at here. Okay, and so if you can find a connection or something or some way that you can kind of introduce yourself and not just be another random name, but be like, oh, this is insert X name that's interested in this, then you suddenly jump up a little bit and that name recognition goes away. So then when you are applying and you're interviewing, it can be like, hey, we met at this conference, we talked about this, right? And now it's a jumping off point versus you being someone completely random. Research, audition rotations, these national meetings are all fantastic places to network. You can meet a lot of people through these things, so I would highly recommend trying to get involved and networking as much as you can while you're a student. Earlier the better. And my last bonus tip, so thank you for watching this long. If you have, hopefully this video has been helpful. This last one doesn't seem as important, but actually can be quite shifting when it comes to thoughts about who someone is, and that is your personal statement. Your personal statement is embodiment of who you are. It is how you want to represent yourself on a piece of paper to this program or whoever it is. Obviously, there's the rest of your application with your extracurriculars, your CV, blah, blah, blah. But your personal statement is you writing about how you want to be perceived in this application. So it's a lot more important than people think, and I think having a strong personal statement goes a very long way. Your personal statement is a place to explain things if you have not had the smoothest journey. So let's say you did unfortunately fail one of your board exams, then this is the place to talk about that, why that happened, what you learned from it, what you potentially have done to improve all those different kinds of things. And it's also a place to express your story and your journey about how you got interested in PMR, why you want to become a physiatrist, and what you hope to accomplish by becoming a physiatrist and what you want to contribute to the field. My number one tip for personal statements is to write it now. It doesn't matter if you are applying right now, if you're a rising PGY4, or if you're an M1. No matter what it is, write your personal statement now. The earlier the better, and that's because if you can kind of write down your story right now, take kind of months off from looking at it, come back at it again with fresh eyes, you really gain a new perspective on kind of what that statement actually says about you. You can be like, whoa, this is what I wrote. This doesn't really encapsulate how I feel. And then you can kind of change that and edit it. And really, I think the longer period of time you can go ahead and edit that personal statement, the stronger it becomes, because you really can start honing it on your story versus it just being some weekend cram of you writing something, or worse yet, producing some ChatGPT or Claude slop about you. Your personal statement should reflect you. When I read someone's personal statement, I want to know who this person is. I want to be like, hey, nice to meet you, essentially, to a personal statement. So I think it should encapsulate your personality, and writing it earlier helps you do that better. All right, and that's it. So this is essentially what I think will help you be a more competitive applicant for pm&R. Once again, I do think it is a tremendously unique and fantastic field. I'm exceptionally happy to be a physiatrist, and I can't wait to contribute to the field throughout the rest of my career. I do think that it requires a different kind of a mindset. So if you are honing in just thinking you want to do pain medicine, or if you just want to do sports medicine, may not be the field for you. There's others that can provide you that same path. But if you embody that mindset of I want to help this person with their function no matter kind of what, then this is the field for you. Once again, take this video with a grain of salt. These are just my experiences and my recommendations for what I would think would make a better pm&R applicant. If there are any program directors or anyone out there who's telling you differently, or if there's anyone watching this that's a program director, and feel free to drop things in the comments if I'm wrong about anything, then obviously listen to them. I'm not a program director here. I'm just a recent grad, so these are my experiences. If you found this video helpful, then make sure you're checking out the MSK Doc on Instagram, where I talk more about sports and spine stuff. Otherwise, usually on this channel, I have more vlog type stuff and occasionally videos like this. But thanks for watching. Make sure to subscribe. I'll see you in the next one.